Each day, 1.3 million people are getting a COVID-19 test, and that is back up where we were in May. Luckily, getting a test is easier now than it was during the start of the pandemic. Many doctors' offices and pharmacies are doing them now. Many drugstores will let you schedule online, then just drive through. It's also now possible to test yourself at home. For a while, you could choose a big public testing site that was free. Many of those have closed, though some are now reopening. So here's what you need to do. Contact public health to find out where they're reopening and when. Who pays for your COVID-19 test gets tricky. The Department of Health and Human Services says thanks to some new federal laws, COVID-19 testing is free to anyone in the U.S., including the uninsured. But that doesn't mean all tests are free. If you get a bill, I'll show you how to fight it in just a minute. First, these rules do not force insurance to cover tests that your job or school require. The Kaiser Family Foundation and the Peterson Center on Healthcare say that means some patients with health coverage may nonetheless receive bills for COVID-19 diagnostic testing. If you have to take a test to go to your job, ask your boss if they've designated a free testing site. Same for schools. Ask. Otherwise, ask your public health office where the closest free public testing site is. Say you're feeling sick or you worry you've been exposed. For health insurance to cover that kind of test, it needs to be ordered or provided by a licensed or authorized healthcare provider. What does that mean for you? Call your health plan and ask. Find out what's covered, what's not, how it works, and have them recommend a place where the full cost is included in your coverage. At-home tests are an option, but before you buy one, ask questions. For example, Blue Shield California's website says it will only cover the cost if an authorized healthcare provider orders an at-home test. What about COVID tests for international travel? We have the same advice as earlier. Call your health plan and ask if they'll cover it and where. If you get a bill for a COVID-19 test, you can dispute it. California's Department of Managed Healthcare says you should first open up a grievance directly with the health plan. Then, if you don't like the response or it takes longer than 30 days, call the state, 888-466-2219, and start an official state complaint.